So we'll go back to our next session in this EU-JAV final conference. And I will give the floor to Mr. Ryan, Director, Public Health Directorate General for Health and Food Safety from the European Commission. Thank you.
I wonder, can you hear me now? Can you give me the okay?
Yes, thank you.
Apologies. So dear European Joint Action for Vaccination, dear colleagues, I'm very happy to be able to represent the European Commission here today at the closing conference of this important joint action. We've had more than 3 years of hard work and coming to an end, and I know that all 20 partners in all the 8 work packages have been working very tirelessly since the 1st of August 2018 to submit the last deliverables, which are due, I understand, by the 31st of March of this year, the official end date of this joint action. And we look forward, of course, to seeing all these deliverables on your website. Today, I'd like to pay gratitude to all the partners and all the work package leaders for their commitment to carrying this joint action through, despite all the challenges posed by COVID, the health crisis of a century, if I might call it that. I'd also like to thank all the involved collaborating stakeholders. Your joint action, of course, is not the only joint action to face challenges from COVID-19, but your joint action is a joint action on vaccination, and this means that many of your partners have also been heavily involved in national efforts to make sure that as many European citizens as possible got vaccinated against COVID as fast as possible once the vaccines became available. Still, you've carried through this joint action, kept it afloat even in difficult times, and I'm very grateful for that. The vertical work packages of this joint action, work packages 5 to 8, have been looking into how we can use an information system for immunization to strengthen the surveillance of vaccination coverage rates across Europe. In work package 5, in work package 6, you were looking at how we can work together to strengthen vaccine supply and preparedness, as well as vaccine research and development in work package 7, and how we can increase vaccine acceptance in work package 8. The horizontal work packages 1 to 4 have been making equally important efforts in terms of coordination, dissemination, evaluation, and integration of the outcomes into national policies. It's also time to make sure that all the good things you have done are now taken up, integrated, and sustained in national policies. There are currently signs that we, at least here in Europe, are transiting into what we could call a post-acute phase of the COVID pandemic. While this will require us to stay vigilant and constantly assess the need for further rollout of new or existing COVID vaccines, including booster doses, it will also allow us to focus again on the importance of vaccination in general, and not only vaccination for COVID. At the same time, COVID has highlighted the importance of vaccination as such, and this gives us a window of opportunity to draw attention to all the other life-saving vaccines at our disposal. Thinking here in particular of HPV in the framework of our EU cancer plan. As you all know, the Commission's work on vaccination in general is based on a Council of Ministers recommendation from 2018. That particular instrument followed on from major measles outbreaks around the same time. There's a roadmap set out in that Council recommendation, and your joint action really feeds in very well into that roadmap. For example, you have helped us to identify barriers to access and to support interventions to increase access to vaccination for disadvantaged and socially excluded groups. You have also developed EU guidance for establishing comprehensive electronic immunization information systems for effective monitoring of immunization programs. Thirdly, you have developed evidence-based tools and guidance in order to support countries to anticipate, to preempt, or to respond to crisis situations. You've also been developing a virtual European data warehouse on vaccine needs. And finally, you've been looking for consensus on unmet population needs and agreed priorities for vaccines that can be used to inform future vaccine research and their funding of this research at national and EU level. All of these things were things we were supposed to do in the text of the Council of Ministers recommendation. So you can see that from the ministerial level at the EU Ministers of Health into what you produced in your joint action, there's a great link between these two initiatives. According to the timeline of our roadmap for implementing this Council of Ministers recommendation, all the actions are supposed to be delivered by the end of 2022. And this means that the Commission, at the end of this year, will have at its disposal a full inventory of actions on which it can base its future work on vaccination in general. I'd like to talk now about the EU for Health programme, which is one of our financial instruments, which is available to us over a 7-year period from 2021 onwards. The EU for Health programme includes an initiative which we call the EU Immunisation Initiative, which we're launching at the moment and which will have the overall goal of increasing vaccination coverage rates, taking the lessons learned from COVID into account. The uptake, the integration and the sustainability of the outcomes of what you've been doing in your joint action, international policies, will also be included as part of this funding instrument. So we'll be trying to reach out to the member states and to our partners in order to channel the available funds into supporting the outcomes and sustainable outcomes of your joint action. I hope that the partners who've been involved in the joint action will also accompany us in the next stages of this process, particularly I would say in respect of Work Package 4, which is concerned with sustainability. And I know that you will have a dedicated discussion on this later this afternoon, including on your sustainability plan. I hope that this discussion will be successful so that the member states and citizens can, in the near future, benefit from all the good things that you've been doing in the joint action. As I mentioned at the beginning of my intervention, there could be no better timing. The COVID pandemic has given us a window of opportunity to promote vaccination. And I hope that we can together use this opportunity to the best of our ability. Thank you very much again, and I wish you success for the remainder of the conference.
Thank you, Mr. Ryan. I don't expect us to have any questions or comment on this intervention, but thank you very much for your support and these remarks and this recommendation concerning the near future of the EU-JAV or the post-EU-JAV period. Thank you very much.